Hello, I'm Dr. Heidi Horsley, Executive Director for the Open to Hope Foundation and host of the radio show, The Open to Hope Show.
Shalom.
Shalom, this is Dr. Ruth Malkinson, and she is the author of the book, Cognitive Grief Therapy, Constructing a Rational Meaning to Life After Loss. She is also the director of the Israeli Center for Rational Emotive Therapy and adjunct senior lecturer at the Bob Chappell School of Social Work, Tel Aviv University in Israel. Ruth, how did you become involved in the field of grief and bereavement?
Well, I became involved in the field of grief and bereavement when I volunteered to assist quite a long while ago to reach out families who lost their dear ones in wars. And after overcoming the initial feelings of helplessness and fear for not being able to help bereaved, I specialized in the field. And I started teaching, doing research, and doing some practical work.
You make a distinction between rational and irrational beliefs. How is this relevant to grief?
Well, I was a student of Dr. Albert Ellis.
Oh, Albert Ellis, wow, a leader in the field.
Right, and when I started working with bereaved families, it amazed me that they all experienced a similar adverse event, losing a dear one, a son, a parent, a daughter, a wife, a husband, and there was a very diverse experience in each individual story. So when I looked at the work of Dr. Albert Ellis, I loved the idea that he made a distinction between rational and irrational belief, and I translated it into healthy and unhealthy grief response to grief.
Healthy and unhealthy responses to grief.
Right.
Okay.
So that means that we look at the response to a loss of a dear one in a way that it involves sadness, pain, yearning, sometimes anger, but it's different than depression, anxiety, guilt feelings. And the idea is that the cognitions are central in the way people appraise the event. And I thought that this was a very, very, very important distinction. And I adopted the idea of rational and irrational negative emotional consequences and applied it into working with bereaved families. And I thought that the ABC model that was developed by Dr. Ellis was very applicable to work with bereaved people. And I think when you work with people who experience a traumatic loss, you allow them and you legitimize the initial responses and of feeling sometimes shocked and guilt, and they blame themselves, and then gradually you help them to turn this into something that is more adaptive. They learn to live with the pain. Yearning is sort of woven into the way they organize or reorganize their life. And I think people can go along with the idea that pain is part of learning to live with a loss.
Pain is part of learning to live with the loss.
Right.
I like that. Ruth, thank you so much for helping people find hope again after loss.
Thank you.
And thank you for being here with us today.
Thank you.
From Israel.
When you work with bereaved people, I usually a Rabbi Menachem Mendel Kutz who said that there is nothing more complete than a broken heart.